And we appreciate your time, Dr. Deonandan. He is an epidemiologist, an associate professor with the Faculty of Health Sciences with the University of Ottawa. He recently wrote for the Ottawa Citizen a list of ways that we could help save Ontario's healthcare system. There are 6 steps outlined in that, and we will discuss them all with Dr. Deonandan. Hello.
Hello, how are you?
Doing well. Thank you for your time today. It's Reshmi Nair and Scott Reed. And I wanted to ask you about that triple epidemic. How do you think Ontario will fare?
You started out by saying you don't want to alarm the audience. I do want to alarm you. I think we should be very alarmed and doubly alarmed because our leaders are definitely silent on this. I'm not confident that we can fare this well because we're not into flu season really yet. And we're already seeing emergency rooms with over 100% capacity. We have people waiting between 5 and 20 hours to see the simplest issue that they come in for. Imagine bringing your child in for a broken leg, for example, and they're waiting 20 hours to be seen while sitting next to infectious individuals. Things are bad out there, and we're not getting the attention or the solutions that we need.
Doctor, your article made me think, and I'm a former political guy, it made me think about the fact that I was hearing nothing but demands from the provinces, and particularly Premier Ford here in Ontario, of the federal government that they increase transfers for healthcare. And then all of a sudden, with a bunch of these similarly, worrying alarms that, the situation is getting bad, it was going to get worse, it was on the federal government, they're going to have to increase transfers. But that seems to have gone. Your article reminded me that I haven't heard that call from the province for a few weeks. Is that because they decided there's too much political jeopardy in telling people that this crisis is occurring in the healthcare system? Is it because they don't think they're going to get a yes from the federal government? Or is it just the news cycle?
I don't know why they're doing anything. I'm not that clever. I do think there's part of this is the blowback or the result of having lifted too many pandemic precautions too quickly, and that has allowed the thrush of respiratory infection to spread widely, and you can't go back and say that was a bad decision, and you look bad for saying so. But it was a bad decision. So that's part of it. I think a lot of this is political, and it's
Sorry,
unfortunate.
Can I ask you I want to interrupt there. Specifically, what was the bad? I mean, there are a host of restrictions that were listed. Which ones would you have not lifted? Which ones do you think should be in place right now?
I think masking mandates in key scenarios like healthcare settings and even highly encouraging them in schools in some grades would be useful right now. Lifting them all at once was a bad scene, especially since we're still in the throes of a wave at that time. The thing about the masking and ventilation and all those great precautions were that they were useful for all kinds of respiratory illnesses, including RSV and flu. And the timing was poor. It also sends a signal to people that there is no more crisis, and there is a crisis, and so people aren't voluntarily taking up the mask or preventing their sick child from going to school or things like that. So if the public thinks that there is no threat, they will behave in that manner. So the messaging has been atrocious. What we're seeing here is a problem of both supply and demand. So supply of healthcare and the demand on healthcare. And we can approach the solution from both ends. The demand side is encouraging people to do things that will prevent them from needing emergency healthcare. But the supply side is what my article is mostly about. There's simple things that we can do to sort of buttress the healthcare system in the short term while we work on longer term solutions.
Will children be the most vulnerable in this winter wave?
I think children and, of course, the elderly are always vulnerable, but the elderly have other options like flu vaccines, and now they have an RSV vaccine, actually. But small children are particularly vulnerable to RSV because of their underdeveloped airways. The mucus fills it quicker, and so they need emergency support to allow them to breathe. And the pediatric hospitals are overcrowded, and there are fewer of them. And as a result, there's less capacity to absorb those children who do get sick.
So you can imagine, even in the time that you've been speaking, our text board, people who are driving home, listening, texting in saying, stop it, don't be doing this. Let's not go back to this talk of lockdowns and mask mandates and restrictions. So there's a visceral reaction right away. One, what's your reaction to that pushback? And two, what's your reaction to people who say, wait a second, we're not on fire. We don't see this. We don't see the hospitals buckled. we don't see the schools shut down again, when it doesn't feel like the spread is intense and as bad, what do you say to people who say, you know what, it's just not as bad as you're predicting?
It didn't feel like we're in the midst of a pandemic when there are tens of thousands of Canadians dying. Just because you don't see the bodies being brought out onto the street doesn't mean people aren't dying. Just because you don't see the stresses on the hospital system doesn't mean there aren't stresses. Take a walk to the ER if they'll let you, and take a look at exactly the stresses that are happening there. Or attempt to get care in an emergency room and see how long it takes for you to get care. Imagine having a stroke or a heart attack or an actual emergency and not getting care for your loved one. That's what we're looking at here. We're looking down the barrel of a non-responsive healthcare system, which is terrifying. Now, to your point of people being fed up with masking mandates and things like that, I understand that, which is why my article didn't focus on that. It focused solely on the supply aspects of the problem, because I don't have a lot of faith in people being able to enact restrictions on the demand side, even though I do think that if we all wore masks for 2 to 4 weeks, the stresses would be alleviated instantaneously, on the system, at least for a while. But again,
Yes.
there are things we can do
Sorry,
to buttress the
Dr.
healthcare
Raywat
system. Yes.
Deonandan, we just ran out of time there, but we appreciate your insights. He is smarter than the rest of us. Raywat Deonandan, epidemiologist, associate professor with the Faculty of Health Sciences, University of Ottawa.
Thank you.